But what we really want to prevent are these hypoglycemic occurrences, fainting, seizures, cardiovascular events. There's a whole host of issues on both sides of the spectrum, but an acute hypoglycemic crisis can be fatal for anybody. That's why we care about continuous monitoring. That's why all this stuff matters.
This is Generation Health. Every week, we bring you the latest in news, cutting-edge research, and time-tested best practices helping you live a longer, healthier life. Sitting opposite me, Mr. Dante DiMatteo, PharmD, Certified Strength and Conditioning Specialist. How you doing, my friend?
Not too bad. Hanging in there. Can you see the special guest we got here? Or are we out of frame?
I don't know. And for anybody not watching, they don't know who the special guest is. It's a cat. It's a cat.
But I'm good. How are you?
I'm good. I'm good. There's no cat on my lap, so I'm particularly good. Sorry, guys. I don't like cats. And sitting in third mic, Josiah Schweinberg, engineer extraordinaire. How are you, my friend?
You know what? I'm still standing.
Yeah?
I'm doing good. I'm standing. So
which is a bit of an achievement, I hear.
That's a W. Yep.
Why is that an achievement right now?
So I ran the Pittsburgh half marathon with no training.
That's
Dante. Don't get mad.
That's brilliant.
He's biting his tongue over there.
It's impressive. Yeah. It's impressive. Some activity is better than no activity, but
yeah. Whatever you need to get started. That's Isn't that it? No. So this will be the third consecutive year I ran. The first year I trained, second year I did a little bit, but this year I was like so undecided.
You just decided to wing it.
My goal was to finish, and I did.
Congratulations.
Yeah, thank you.
Yeah, it's awesome.
My kids, they're like, "Did you win?"
Yeah.
You know what I tell them?
Yes. Yeah.
Yes,
right.
I did. Do you see this medal?
They don't just give this out for participation.
That's right.
Mm-hmm. Where do you go from here?
Oh man, I don't know. So a good friend of mine, he's training for a half Ironman, which is like, I think it's over a mile open water swim, and then like a 50 some mile bike ride, and then a half marathon at the end, the 13.1. So I don't know. We've always said like we'd like to. Him and I, we always train for the half marathon, or we run the half marathon. It's like, man, we got to keep our accountability up and keep running and keep all that up. So maybe I will. I think I definitely want to just run the half marathon again next year. But it was kind of like what we were talking about a little bit right before the episode. It's like if I was disciplined in my running and scheduling my runs and my mixed cardio and biking and those things, then I'm like disciplined in a lot of different areas of my life. And life is just more holistically healthy.
Yeah.
Wow. What a concept. We talk about that kind of stuff all the time. But
are there other marathons or half marathons in the area that you can do between now and a year from now?
So in the fall, I've done the past 3 years, I've done some sort of like mud run, like just kind of like
those are fun.
Those are
more
great.
Obstacle based.
Yeah. So you're doing a little more climbing and using a little bit more. And then so I think I've done, one was at a ski resort local here to the area. And it was over 3,500 feet of elevation.
Yeah.
7 miles.
Ugh.
Dude, it was crazy, but it was a blast. Those obstacle runs, and it breaks up the, kind of like the steady grind of just running like a marathon.
Yeah.
Cause you're climbing these obstacles and stuff. Anyway, sorry. I'm like,
no, you got excited.
No, it's great.
I don't mean to be.
I think you've done there's nothing wrong with continuing to stay prepared for the half, but it would be fun for our sake to see you do the full and not just do it, but see how you get there.
Wow.
Just to, and I think from a life perspective as a, working full time, you have kids, how you fit, seeing how that would fit into your life could be useful for us, useful to listeners.
Absolutely.
That level of training for a lot of people, it's tough as far as time constraints goes, but to see how I know you would make time for it, and I know that again, it would be useful for people to see how it fits into a busy lifestyle. Training for such a lofty goal like that.
If you want to see Josiah training and help him stay accountable, drop a comment down below and we'll make sure those episodes come out.
That's where I was getting.
I think
That's what we got to do.
I like
We
it.
got to rally up. Even if we buy some, fake, we can just get a bunch of fake commenters.
Yes.
Make some fake emails.
Buy
bots.
some bots from China.
Some AI bots.
There's
Yeah.
like 50 bots that want to see Josiah push it to his physical limits.
Great. Now I have like no choice. But you know what? I will say that means a lot.
Cool.
Speaking life, encouragement. I'll take it. I appreciate it.
Yeah.
And one, just real quickly, what you said about the discipline in running or in training for something helps you be more disciplined in everything else. That has absolutely been the case in my life. And I don't know exactly what that is, other than to say it's the self-control muscle that when you exercise it, it gets stronger and it becomes much easier to go, Oakmont Bakery, you're good, but I think I'm going to drive past you today. I don't think I'm going to stop.
Yeah.
I don't know what that is, but I think it's cool, and it's been true in my life. Financially, I'm much more disciplined when I'm on my schedule training and doing stuff too.
Yeah. What is not to go there, but I have to.
Yeah.
What does scripture say? It's like nobody likes discipline, but if you stick with it, it returns a great harvest for you. So nobody likes it. Nobody likes it, but stick to it. It's so beneficial for you.
That is fantastic. Thank you for sharing that. Dante, what are we talking about other than half marathons?
We're going to talk about continuous glucose monitors.
No kidding.
Yeah, exciting.
Well, that's funny because behind the counter, I have an article about that. For decades, researchers have been trying to develop a way to measure blood sugar levels without needles. That's the standard measurement protocol. Existing optical sensors require bulky lab equipment, making them impractical for everyday use. And a major challenge has been differentiating between glucose and water in the body, as they both absorb light similarly. But a new study described a promising optical sensor that uses infrared light to measure blood sugar levels. Researchers identified unique infrared signatures in glucose that allowed them to distinguish it from water in blood plasma. The sensor itself is lightweight, flexible, and can be worn on the skin. It uses Bluetooth and a coin-sized battery for continuous monitoring. In lab tests, the sensor accurately measured blood sugar levels in a range comparable to existing sensors. This technology has the potential to revolutionize diabetes management by offering a pain-free and convenient way to monitor blood sugar levels. It's only a matter of time until this finds its way onto a smartwatch near you. That's it. That's your lead in. I had actually picked that article before we picked this.
Yeah.
I'm just taking credit.
No, I thought that was a perfect segue to what we're talking about. And to be clear, we're still not there yet with so the glucose monitors that we're going to be referring to are those that are actually inserted kind of through the skin. They're measuring the interstitial fluid, which we'll talk about. These are ones, again, that are non-invasive in any capacity and would function more like a smartwatch would. So,
yeah.
But I think that just seeing the evolution of this, like the, continuous monitors are more and more prevalent as it is. People are more than willing to, non-diabetics, they're more than willing to slap one on the back of their arm and purchase them out of pocket, let alone the monitoring and the perseveration that's going to take place once these measurements are available on the watches and the Fitbits and such.
Perseveration?
I think it's applicable there. I'm not sure.
Act of repeating something such as a word, gesture, or action over and over again.
Yeah.
Wow.
See that?
Good word, Dante.
Thanks.
Perseveration.
It's a good one.
So yes,
I know it because I do it.
You do. You perseverate.
So.
Okay, so wait a minute. So we're talking about
and perspirate,
continuous glucose monitors, and the reason that you wanted to cover this is that they're going over the counter, which is a big deal.
Yeah.
Okay. And we're not talking about the optical glucose monitors that were behind the counter that we just mentioned. We've confused ourselves with all these terms. That's my fault. No, continuous glucose monitor. So let's start there. What is a continuous glucose monitor?
So they're just components that are placed onto the body that instead of measuring getting a glucose measurement as we're accustomed to, either, intravenously or in the capillaries, or whatever the case, that would look at a snapshot or just a single measurement. Continuous monitoring is just looking at that over the course of, different time intervals, whether it's every minute, every 5 minutes, every 15 minutes. It's doing this without your conscious control or without your conscious measurement. So that's the concept of it.
Okay. And why would we care about our glucose levels, blood glucose levels?
So in general, they're critical, especially in the context of diabetes.
Right.
Obviously, type 1 diabetics, type 2 diabetics. That's where blood glucose measuring is essential. It's essential for the diagnosis. It's essential for management. So constantly looking at these values they're critical. And where where some of this conversation will dovetail is the interest of non-diabetics. So the, theoretically healthy population is now taking interest in these different measurements.
So blood glucose monitors, how do they work? What's going on? Continuous glucose monitors specifically.
Mm-hmm. So if we look specifically at one of the continuous glucose monitors on the market, initially the first actual iteration of this was released in 1999 or 2000. So the technology has been around for a while, but with each release, with each improvement, these things have really improved, really expanded. There's a multitude of use cases and such, but in general, these can be distinguished again from a self-monitored glucose, or again, the measurement of intravenous blood or, capillary blood, in that the continuous monitors, it's a tiny needle that essentially inserts a tiny filament into interstitial fluid, which is basically the kind of the subcutaneous layer, goes through the subcutaneous layer of the skin. So it's not reaching capillaries, it's not reaching your vein. It's essentially measuring the fluid in between a blood vessel or a capillary and the skin, the interstitium.
Okay. So when you say, so we're talking about, so this is just for the clarity's sake, CGM, continuous glucose monitor, that's different from, what did you say?
You're right. Self-monitoring of blood glucose.
So we're going to say CGMs just for clarity's sake.
Yeah.
That's the device we're talking about. And you said it's a tiny filament, like literally it looks like a fiber optic
right.
Wire. And it goes under the skin, but it's so small and so shallow that it's not like it's almost like a splinter, except it's probably feels even less than that, I would assume.
Right.
So it's not invasive.
Right. So users, I've never used one, but users will say that there's a little bit of a pinch. They can be applied to. You'll commonly see them on the back of the arm. There's some adipose tissue there. Anywhere you kind of see, subcutaneous injections given. So the abdomen, the thigh, even the calf, the back of the arm. Those are the most common sites. I would say the tricep area being the most common.
So somewhere there's just a little bit of fat and it's out of the way.
Right. And there's a little, like I said, users will say there's a little bit of a pinch, but once it's in there, again, because the needle is technically retracted, it's not like this persistent pain. And beyond some reactions from the adhesive that's actually on the patch or on the device, not a whole lot of physical issues that stem from use,
Okay, so it's measuring in the interstitium, you said? Interstitial fluid. How is that? That's different from self-monitoring or the traditional method. Am I getting ahead of us?
No, that's great. That's a great point.
Okay, so
I like this, this pace.
This is
Tyler.
good.
It's good pace.
All right. All right. So the interstitial measurement of a CGM is different slightly from the blood measurement of self-monitoring, the traditional self-monitoring.
Exactly.
Okay. How? Why?
Essentially, you're getting a lagged measurement of what's happening in the bloodstream, so to speak.
So you're getting the same numbers, but it's slightly later than if it was coming out of the blood.
Exactly.
And that makes sense.
Exactly.
The glucose goes into the blood and then it goes into the interstitium and then eventually into the cells.
Right. That's essentially how that functions. So for some people, it might seem jarring. Well, how is this? How could I possibly be getting a blood glucose measurement if this filament isn't even extending technically into that main compartment of blood?
Right.
So it's the compartment just outside that circulation. And so it is strange, but again, there's enough of the research and just kind of the physiologic understanding of that, is enough to say that you are getting a nice proxy of what's happening in the blood.
Okay.
So again, that lag time is anywhere from like 10 minutes or so.
Okay. So it's not even that long. It's a few minutes.
Mm-hmm.
Okay. Who are these used for? This is primarily for type 1s and type 2 diabetics, right?
Yes.
Okay. Get into that for me. Help me understand why this is relevant and how that's used for them.
Yeah. So they were originally approved currently they're only approved in type 1 and type 2 diabetics.
Okay.
And at this point, they're still not available over the counter.
You have to have a
prescription and kind of have to technically have to fall into this category in order to use them. Although it's easier to get them.
Most doctors are probably going to be happy to write you a script for that if you're a diabetic.
Mm-hmm.
Okay.
Mm-hmm. It's just because it can't be argued how useful blood glucose monitoring in general and continuous monitoring, how useful that it's been for type 1 and type 2 diabetes. Because of that, now there's this push to say, okay, well, it's worked so well in helping those individuals manage their care. What about those that are maybe close to pre-diabetes or have pre-diabetes? Or what about just your everyday marathon runner? How can this be used in that population? It's tempting to want to extrapolate the information we take from a pathophysiologic state and apply that to, a general population, let's say.
Okay.
But in general, again, these devices that's who they were meant for, those with, dysregulation essentially of blood glucose and insulin.
Okay. So this doesn't, this is just measuring the levels in the blood. This doesn't impact insulin at all. It doesn't change the insulin levels in your body, right? That's a separate thing.
Exactly. So with the continuous monitor in and of itself, again, you're just getting that measurement of glucose in the interstitium reflective of what's happening in the bloodstream. Now, where the use of these have even gone further are those, especially with type 1 diabetes.
Okay.
And so there's something called a hybrid closed loop system.
Ooh.
And so all that really means is you have a continuous monitor and then you have a separate insulin pump. And so those two devices, they talk to one another, and whenever an individual's blood glucose falls out of range, it elicits a dose of insulin based upon where that level is. And so a lot of this medication management for an individual, which can be quite cumbersome, it can be difficult, it can be hard to get completely right, over the long term. These closed loop systems have made life, a lot easier in those who require insulin use.
Yeah.
And so I think that's like the sort of the pinnacle of where we are with some of this.
Yeah.
Again, you have something that's continuously reading your blood glucose levels, and you have something that can detect where that is and then administer a dose of a medication that's helping you manage your condition. Like that's the fruit of all this research.
Right. And they talk to each other, and it's relatively hands off for those people, almost enabling them to live in the same way you or I would with a fully functioning pancreas.
Sure.
That I don't think about my blood sugar levels and tell my pancreas to excrete more insulin.
Exactly.
It just does it.
Right. And I like that you mentioned it in that way. It's not that we're saying that we know everything that goes on in the life of a type 1 or a type 2 diabetic.
Right.
That's not the point. It's just that when you think about pre-1999, before some of these devices exist, or maybe you were just using an insulin pump and you were still self-monitoring glucose with finger sticks and lancets and in a meter in a traditional sense, it's more or less highlighting how this continues to evolve. It's only going to get, it's really only going to continue to improve.
Okay.
Because now it's like, you don't even need meters sometimes. It's the readings from either your continuous monitor or your, test strips or whatever, that information can often just be sent to an app on your smartphone at this point. So,
Wow.
you can see how a lot of this care has been so integrated into a normal daily life.
Yeah. Make it personal here for a second. My grandmother was a type 2 diabetic who lost her eyesight. And I remember growing up watching her get the finger sticks and the injections of insulin. And this is back in the 90s. So tell me about that real quickly. What is we talked about it briefly, the finger sticks, self-monitoring. That's the traditional method. Are there any advantages or disadvantages to that other than just nobody wants to poke themselves repeatedly?
Right. So you are with the traditional method, which will require testing anywhere from 4 to 10 times a day, which is a lot.
Yeah.
And so with that, there's tons of controversy on what the optimal frequency is. Is it 3 for this person? Is it 5? Could somebody have had better outcomes with 6 or 7? That's where, again, these continuous monitors step in to give you a better snapshot. But in general, you'll see, as far as the process of self-monitoring, it's, a finger stick, the blood from the finger stick goes onto a test strip. The test strip is in a meter, which then reads and spits out the information that you're ultimately looking for.
Okay.
And then from there, you take action, whether you need to, take consume glucose or additional insulin or medication.
And that's why she would keep candy on hand or something like that, some hard candy.
Exactly.
Got it.
Exactly. And so, there are benefits to traditional methods.
Yeah.
If you are continuously monitoring and there's an issue with calibration, or you're just opening the continuous monitoring box for the first time, some of them still require a calibration process. And what are you calibrating against? Your tried and true traditional measure. So I like that we mentioned that, but just because those methods are not obsolete at this point, they're very much a part of the everyday care of diabetes.
Okay.
So
you're still doing that.
Yes. And as we mentioned with the lag effect, if you need a measurement that is truly real time, you are going to get that from, again, a measurement directly from your capillaries or from the bloodstream.
And if I remember right, there were situations where 5 or 10 minutes could make a big difference in terms of outcome. I seem to remember my uncle was also diabetic, having sugar crashes and like sitting down and being completely spaced out of it for a while. Mm-hmm. So having an immediate, faster answer makes a difference. So okay. All right.
Yeah. So if you've had something that causes an immediate rise in glucose, if you're looking at your continuous device, it could be 5-10 minutes behind a serious hyperglycemic response. Or on the flip side, if you have a rapidly falling glucose, your levels might actually be lower at that moment in time than what's showing on your monitor.
Okay. So I know what makes a blood sugar spike happen. That makes sense. Sure. What would cause a sudden crash like that?
Yeah, that's a good question. So the way to think about this is that blood glucose is that's a snapshot, again, of what is happening under the hood. That in and of itself, I guess, isn't the disease state, because we can do things to manipulate our blood sugar.
Sure.
You can make it look really good, or you can make it look really bad in the short term, bad by consuming a ton of Sour Patch Kids or whatever.
Right.
So there's this dysregulation that's occurring under the surface. There's this disruption in glucose homeostasis that essentially leads to these swings. And so somebody with the disease state present is going to be more susceptible to these swings. And whenever, let's say, you consumed a meal much later than you normally do, you might be at risk. You don't have as much of a buffer for that glucose control. So if you've consumed a meal later than you normally would, your glucose might start to tank sooner than yours or I would.
Okay.
Maybe there was a little more alcohol consumption than normal, without the presence of other food, and maybe hydration is playing a role. Maybe you're already on oral glycemic lowering medications. Maybe the dose was wrong. Maybe you took too much insulin. Those are all instances where, an acute swing like that can occur. But again, at a fundamental level, all of this time spent out of range is essentially telling us that, hey, there's something, there's that glucose homeostasis is off in some way. So you can be on the high end, you can be on the low end. Either way to the extremes can be quite devastating.
Right.
But what we really want to prevent are these hypoglycemic occurrences, fainting, seizures, cardiovascular events. There's a whole host of issues on both sides of the spectrum.
Right.
But an acute hypoglycemic crisis can be, fatal for anybody.
Yeah.
So that's more or less an aside, but something that's why I think these conversations come up so frequently. That's why we care about continuous monitoring. That's why all this stuff matters, is because, those crises are serious.
Okay. So bringing it back to that, sorry for distracting there for a moment.
No.
It seems like the traditional method, while being tried and true, there's some drawbacks. I don't like poking myself repeatedly. And if you have to do it, half a dozen times a day, that would not be fun. Are there any other major issues with the traditional method that would cause us to seek something like a CGM?
There are. Again, just going back to the controversies of what's the optimal frequency of testing?
Right.
It doesn't sound like that big of a deal. Are most people fine with 2, 3, 4, 5 times a day? Sure. But again, there are other people who require more frequent testing who aren't. Adherence is also a challenge, obviously. If you're working or you have other life responsibilities, always stopping everything to get a blood glucose reading is a challenge. And so, with any of these interventions, we always come back to adherence, and that's a huge one. Now, what are the downstream consequences of, less than optimal adherence or less than optimal frequency? That's where we see the complications that we care about with respect to diabetes progression. So damage to the eyes or retinopathy, vision changes, the neuropathy or the nerve damage in the extremities that we often hear about.
Yeah.
More likely for those things to progress. Nephropathy or the downstream kidney issues that result as a consequence of management of diabetes that, again, was less than optimal.
Okay, that makes sense. So keeping on top of it.
And also increased hypoglycemic episodes, as we previously were mentioned, how serious those are.
Right. So keeping on top of it is a big deal. You've got to keep those numbers. That makes sense. CGM, new technology, brilliant.
Right.
Okay. So the benefits of a CGM, we're talking about fewer, maybe not zero, but fewer needle sticks. And I imagine those would get expensive. You start doing that half a dozen times a day and all the other things that go along with it. I know being diabetic in general is just not cheap.
Right.
Right. What else? What am I forgetting? There's the consistent being able to look at the data over time and see how things are consistent or not consistent, as the case may be. What else?
So you because it's being continuously monitored, you can see where these excursions or these deviations or time out of range take place. If you're just looking at plots on a graph of 4 random times throughout the day, what about all the what about all the little dots between going from A to B? So for a better picture of these excursions that are concerning in diabetics. And then also, again, we're looking to reduce A1C over time, which is an important marker of diabetic management and diagnosis of diabetes. And so data supports that when using CGM in these populations, you can see better outcomes that we're actually measuring down the line.
Okay.
So
what is the phrase I heard somewhere is what gets measured gets managed. So it makes sense. The more measurements, the more data you have. Okay.
Yes.
I'm sold.
And again, we're still, to be clear, we're still talking about diabetic populations.
Right. But even so, For the diabetic populations, what are the downsides to a CGM? We just talked about the traditional self tracking. For CGM, are there any major downsides?
There are not. Again, we talked about some of the minor skin reactions that can occur from the actual adhesive on the patches, which is generally minor. The big thing that we mentioned too was the lag effect.
Okay.
And so when using these, you have to know that, again, the measurement that you're getting, they're going to be a little bit behind what you would read from a traditional method. And then ultimately you're still going to need, this doesn't, again, totally alleviate the need for having Lancets on hand and test strips on hand and the whole other kit that maybe somebody was accustomed to using. Just because you have a continuous monitor doesn't mean you just throw all those things away. So although it really changes your natural daily management, doesn't mean that all the other stuff just goes away. So it's certainly not foolproof in that respect.
Is there a massive cost difference between the two?
It's hard to say. This is where insurance really steps in. So for the most part, someone with insurance can get all of these supplies and measurement tools covered at some point. If you had to buy all of it out of pocket, if you had to buy sensors and readers and you bought the monitoring device that goes with the CGM, and then you had to buy a lancing device and Lancets and test strips and a glucose monitor. If you had to buy all of those things, I would imagine out of pocket that the costs would be pretty similar.
Yeah.
But for everybody that has insurance, it makes a difference.
Okay.
And so where we start to see some of these cost issues rear their head is, individuals who are buying them out of pocket out of curiosity. I'm curious and I think this might help me manage my blood glucose better, even though I don't have anything diagnosed. It just might help me manage it better because I'm curious. Those costs can get quite out of hand.
Sure.
And then also there still hasn't been a price as of, May of 24 of what that new over-the-counter continuous device will be. I mean, they're speculating like in the 80s to 90s per month for that all-encompassing system that you would get. But that's a substantial investment into your health.
Sure. Okay. So let's talk about that then. So prior to now, a CGM required a prescription from a doctor. Probably not hard to get if you're diabetic, but for the general population who may or may not just be interested in what their blood glucose is doing, that was a different conversation. But now these are coming over the counter, meaning no prescription required. You can just walk into a pharmacy theoretically and purchase one.
Right.
Why would I want to do that?
There's a ton of reasons.
Okay.
There are a ton of reasons. I think that, hey, we have a podcast that talks about health. We sell supplements. We do consultations. We have a pharmacy that's involved. There's all these ways that people can tap into managing their health in different aspects. We've had episodes talking about different biofeedback, resting heart rate variability, all these things that we're really curious to be measuring, and all these ways we're trying to optimize our health. This just feels like another one of those things for people. And then when you have influencers and you have people on, on Instagram and on YouTube who, again, they haven't been diagnosed with anything, but they have these devices and they're using them out of curiosity, it can't help but spark this movement of people who are consuming that content to be equally as curious.
Yeah, absolutely.
So to sort of complement that, my understanding is that somebody eats food, and we all know, we all hear of blood glucose spikes or my blood sugar spikes, and I think that's bad. It's probably not good if my insulin is spiking or my blood glucose is spiking, and this word spike is just
spike sounds bad.
It sounds very bad, and so you now have a device that isn't thousands of dollars, that for $100 a month, $170 a month. And for a lot of people, that's reasonable, that now I can have something that tells me anytime my blood glucose spikes, and I can trace it back to the meal I ate. I can trace it back to if it was a time I was exercising. I can trace it back to a time if I was really stressed. I can link it to a night that I had really poor sleep. And so again, it sounds just like all of those biofeedback things that we've talked about before, with things that can be measured on a smartwatch. And so because of now how easily integrated these systems are into daily life, it's like, well, what's the difference? It's like tracking my steps.
Right.
And so I think with the rest of this conversation, we can shed some light on why I think that it's maybe not at this point, not like tracking steps.
Okay.
So does that help kind of launch us a little bit?
So help me get into that then. So I track my steps. I had 14,000 yesterday. I was very proud of that.
It's intense.
It was lots of walks.
Mm-hmm.
I don't understand the downside. I want to know that when I do stop at Oakmont Bakery, that there are consequences to that. And I can see these numbers and I can track it and I can put a note on my app and go, that was the eclair.
Yeah.
Don't do that again.
Yeah.
What's the downside to that? Other than the cost, what's the harm in knowing these things?
Off the top, it is low risk. Truly. I can't argue that. I don't think anybody's arguing that it's a low risk device. It's a low risk intervention.
Right.
And again, that's why the FDA now is allowing this to be an over the counter product, and for a lot of people, increasing access to something like this can make a difference, especially if you're somebody who is reluctant to going to the doctor initially. You're like, you know what? I just don't want to go, but if I just buy this device and it nudges me towards a diagnosis or it nudges me towards making this appointment, seeing a specialist, then maybe that's a good thing.
Sure.
Not arguing that. But in general, the risks, it's not even so much the risks. It's just that, is this really going to be telling us things that we don't already know through traditional testing? And also, is this really going to guide us to make individualized dietary decisions? Is this really going to detect prediabetes sooner than something else? Is it really because why measure it if you can't use it for something actionable? You know what I mean?
Sure.
And so for a lot of people, again, it comes back to this idea of blood glucose spikes. Some will think that, hey, just because I saw this spike in glucose, that means that I gotta avoid the food that did that.
Right.
Well, what about we know a normal fasting glucose is anywhere from 65 to 99-ish. Okay. 65 to 99 milligrams per deciliter, let's say. Well, what if after I ate, my postprandial glucose got up to 96? Well, it's just below the cut point. So maybe I'm good, but maybe next time I might do a little bit less of this so I can try to get it down to 90.
Okay.
Well, inherently with all these measurements, there's the chance for some inaccuracy anyway. So we're talking, what I'm trying to say is that now we're talking about micromanagement, which I think is still the common theme with some of the drawbacks that we talked about in the smartwatch discussion.
Mm-hmm.
They're great. These tools are great when you can step back and look at maybe how they've changed overarching, behavior patterns.
Mm-hmm.
But to micromanage that a food that you ate caused a spike from 80 one time to 90 the next time.
Right.
How useful is that? At this point in time, the literature, we can't say that that's doing anything, and it's not going to guide any sort of changes in care.
Okay. So if I understand what you're saying, I decide I want this information. I'm concerned or interested or whatever. I have no reason to necessarily suspect that I'm pre-diabetic, but I wanted the information. So I spend the money and I get the device and I start monitoring. And then lo and behold, I eat a banana and I see my blood sugar spike, and I'm going to decide, oh no, I can't eat bananas because my blood sugar went too high. But when I eat, I don't know, a steak, that probably wouldn't make my blood sugar go up so much because there's not a lot of glucose in that.
Exactly.
Okay. So maybe in this case, I'm taking things out of my diet that are perfectly healthy. There's no reason I shouldn't eat a banana. A banana is good for me. A steak can be good for me too, but the idea that one thing is good and one thing is bad just because I saw a number on a strip one time. Oh, hey, bro.
Oh, sorry.
That's okay. That's okay. We were
afraid of
that's
it.
Okay. That's all right.
The
cat, for the people that aren't watching, the cat just jumped into my lap.
Just interested.
He's
trying to learn too.
He wants to know about his blood glucose.
Mm-hmm.
So what you're saying is that the concern, the problem would be micromanaging.
You're going to be making ill-advised decisions on things that don't really need a decision.
In the same sense that if you go for a run and one time you have a weird pain in your side, you don't stop running because of the weird pain in your side. You go, oh, I had a weird pain in my side. Maybe I should stretch more, or maybe I should, take it easy for a couple days or hydrate better.
Exactly.
You don't just assume that was evidence that you're doing something wrong.
Exactly.
Is there a way that this can be used without so much hyperfixation on those little details? I mean, is it okay to get this information so long as you take it with a grain of salt and you pay attention to, look, this is just, we're looking at trends, not spikes necessarily.
Eventually, yes, I do. And I think this is where the initial article that you brought up comes in.
Yeah.
Once somehow these measurements for the healthy population are just a part of a smartwatch, you're not really making any extra effort to get this measurement. You're not going and setting up a new additional system. Like you're wearing a watch, you're wearing a Fitbit, you're wearing this, and then you added a glucose monitor. Once this is integrated and you're just and it's just a part of kind of the everyday information that you might be looking at, and you're not really making acute decisions about it, especially if you're not working with a healthcare professional or you don't have some really deep understanding of this.
Right.
Then I think that's where eventually I can sleep at night about this whole thing. Do you know what I mean? It's just the idea that there's tons of people going out of their way to use something like this that they probably didn't need to, because again, a lot of this information, if you have a relationship with your PCP, if you're seeing a healthcare provider, if you've had blood work done, if you've been screened for other conditions, if you've had your BMI screened, if you've had, your height and weight, for goodness sake, a lot of these things that are already, indicative of other metabolic diseases potentially. If you do all these other things, it's already going to kind of give you the information that potentially a few blood glucose readings on a continuous monitor might. Okay. You know what I'm saying? So again, if you have some basic blood work done for any reason, there's going to be there's generally going to be a fasting glucose measurement on there.
Yeah.
And if you're a certain age, certain demographic, you might even have an A1C measured, which is essentially just a snapshot of your blood glucose over a 2 or 3 month period. So right there, you have two metrics that are used to help diagnose type 2, type 1 diabetes that might warrant further investigation. As of right now, there's not a whole lot wrong with the measurements that we have. And I didn't even mention, kind of the glucose challenges or oral glucose tolerance tests where, okay, we have somebody, they have a blood glucose that was measured in plasma that was maybe a little bit out of range or a little questionable, or maybe this individual is carrying some additional adiposity. So then let's take this a step further. Let's get an oral glucose tolerance test. So essentially, they give you a standardized meal, essentially, of glucose, and they look and see how your glucose responded after a 2-hour time period. And what does that sound like? Exactly what a continuous monitor is kind of looking at already. And so again, you can get a lot of this information in the context of working with a healthcare provider where you can then make an informed decision if you're really concerned about prediabetes and diabetes. And then if maybe there are even drawbacks with fasting blood glucose and A1C. There's occasionally times where those measurements are discordant. So somebody might have a normal A1C, a relatively normal A1C, and really there is some glucose homeostasis dysregulation occurring. That can happen. And so that is maybe a situation where there are even additional tests that I'm not even mentioning. But that could be an instance where, hey, if it's low cost, low barrier to entry, we can look at somebody's blood glucose over a continuous period, again, to see some of those excursions that maybe we couldn't catch on finger sticks. And so my point is, people look at these monitors as if like, well, I'm not, my doctor would have never found this information out for me if I didn't put on this glucose monitor. And that's simply untrue.
Yeah.
There's a very thorough workup if you're suspected to have some sort of glucose dysregulation occurring. I can go on, but I think
that's good. So again, if I'm understanding you correctly, you're saying there are a whole host of signs if blood glucose homeostasis might not be correct for you. There might be some dysregulation. There's a whole host of signs that are going to show up in a whole bunch of different ways. Mm-hmm. And the likelihood that you and or your doctor are not going to catch it is exceedingly low.
Right.
So it's not like getting an over-the-counter blood glucose monitor is critical for everyone, because if you don't get that, we're never going to find out that you might have these issues. We're going to find out anyway.
Yeah.
So then who are we talking about? We're talking about the people who are really wanting to dial in their health or are just really curious for whatever reason. So you're already talking about a pretty small percentage of the population, but that same percentage of the population is also the percentage that, hey, that's me, has a tendency to fixate on one or two very specific things and really try to micromanage that thing. And I think what I hear you saying is that this might just make that worse, that those people who already have that tendency are going to fixate on one small number instead of looking at the bigger patterns or the bigger issues, that we're going to pathologize something that's totally normal, because your blood sugar spiking after you eat something sugary, that's what it's supposed to do.
Right.
Right?
Exactly.
And then if your body is functioning properly, it comes back down.
Right.
And to just look at a number on your screen and go, oh my gosh, my blood sugar spiked. Well, yeah, it's supposed to. That's how that works. Calm down. Don't make radical changes based on one thing you see on a screen. Okay.
There's so much. You might have had a follow-up question there, but there's so much to unpack there. And one thing I didn't want to lose sight of.
Yeah.
Not saying you would do this, but someone with a similar mindset, what eventually occurs is the gamification.
Yes.
So you mentioned the steak, you mentioned the banana.
Yep.
You eventually, if you're really tightly managing this or looking at this information on a continuous monitor, you're going to say, hey, yeah, the steak didn't really spike my glucose. Those are the kind of foods I want to eat. I'm going to start avoiding carbohydrates, and it'll nudge you towards a dietary pattern that maybe that's fine. But really, again, you're kind of just artificially creating these numbers, right? They're just because a carbohydrate is more likely to increase. I'm not even going to call it spike, for goodness sake,
right?
To increase your blood glucose a little bit after you consume them. That just doesn't reflect a pathological state. And so again, you have this gamification and people nudging themselves to dietary patterns that that are sort of ill-advised.
Yeah.
If you want to consume more animal meats, that's fine, but don't do it because don't really put your eggs in that basket because of from a blood glucose perspective necessarily.
Right.
I
know nothing for certain, but I suspect that I was on the fast train to pre-diabetes for a long time. I had crazy spikes and drops, and I could feel there would be times when I would just feel my blood sugar drop, and all of a sudden I'm sweaty and nauseous and just, it was a bad deal. And I would go out of my way to find sugar that I didn't need, and I would eat it regularly. It was bad. And I did make pretty radical changes to bring that under control. Had I had this data, I know for a fact that I would have made even more radical changes that probably would not have redounded to my benefit ultimately.
Sure. Instead
of getting on a healthier pattern, I would have just gone to an even greater extreme. So I hear what you're saying, because it's hitting home. Okay, so what is the punchline here for people that are interested in this sort of thing? For somebody that is concerned about their blood sugar for one reason or another, whether they've been living in a dietary way that they know they shouldn't be, or they're not exercising enough, or their BMI is kind of out of whack, or maybe their doctor says, hey, it might be worth thinking about something like this.
Yeah.
If somebody is looking into this, what's the takeaway? What can we suggest to somebody when it comes to using a CGM over the counter as part of their health routine? Because you're not saying it's a terrible idea.
Mm-mm.
There's just some asterisks. What's the takeaway?
So I view CGMs often as another, unfortunately, controversial topic. It comes up like hydrogen water. It comes up like cold plunges. All of these seemingly polarizing questions. And that's why it's on this episode.
Yeah.
So, but regardless, with all of those things, I'm never in a position to talk somebody out of doing those. Again, we provide information on this show. So if you are convinced that you need to use one of these, or you want to use one, or you're just so curious, go for it. But just do not take the information. Try your best to keep the information in context. Tell your doctor you're using one. Maybe get some blood work done, or don't even go out of your way to get your own blood work done. Just see your doctor.
Yeah.
You know what I mean? See your doctor, and let them be a part of this. Let even if it's not your doctor, somebody involved in your healthcare, let them be a part of what's happening here. Because my biggest fear is for somebody to, again, start to micromanage and lead them down a path that's not realistically going to cause overt harm, I would say, but just going to take you away from other things that you can probably be paying attention to.
Right. It's not a major necessarily. Right.
Mm-hmm.
I mean, if you're diabetic, obviously this is major, but you already know that.
Mm-hmm.
But for somebody who is healthy in other aspects, this is a minor. This is not the thing that needs to be focused on necessarily more than anything else. So major on the majors, minor on the minors.
And look, if you are somebody that says, you know what, I've already had blood work done, and my fasting blood glucose is towards the top end of this normal range. So now I just want to see, okay, go ahead, take a look. What I can tell you is the data that does exist in those that are healthy using continuous monitoring is that the blood glucose is essentially in a normal range that entire time. So again, what is it really going to be telling you? The fluctuations, I'm not even going to call them spikes. The fluctuations that occur within the normal range it's like time wasted on useless information. You know what I mean? I hate to be that black and white, honestly, but for the most part, it is. If you start to see these excursions beyond that, again, those are things that would be detected in some other traditional method for the most part. And also, at least one thing with the oral glucose tolerance test is, again, that's a standardized, that's like a fixated amount of glucose that you're consuming. It's a tightly controlled window so that those results can be standardized and compared across a large population of people. Now, if you try to do the same thing with your continuous glucose monitoring to say, hey, here's what happened 2 hours postprandially, then is that really telling you the same thing that a oral glucose tolerance test is telling you? I don't know.
Yeah.
We just don't have that information yet. What I will say is that it's possible. I think before these monitors become sensors on our Apple Watch, our smartwatches, that eventually we might have those cut points that say, hey, there's this pattern, there's this certain thing in our algorithm that nudges you towards go get another fasting blood glucose reading. Maybe check a finger stick, like some sort of guidance. I think eventually we get there, and we're happy to change our minds at that point. But where we are right now, having to buy these things and spend a chunk of money out of pocket to use them, it's probably can be money spent elsewhere.
Where else could you spend that money?
on a multitude of things. My goodness.
Yeah. Yeah. Get some nice running shoes and go for a half marathon. That might be a better use of the money.
Or train, begin to train.
And
that too.
And that's, I know we're wrapping up here, but that even reminds me of another subset of people who want to use these. So we were just talking about healthy, curious individuals. There's also maybe not a ton of people listening to this show, but there's a chunk of people in a more athletic setting that are now using these. If you watch the US Open or you watch any golf, or I've seen guys with CGMs on the back of their arms.
Yeah.
And I'm not aware of I'm not aware that some of them are type 1 or type 2 diabetics. If they are, then just disregard this. But from my understanding,
We're not talking to those people.
We're not talking to them.
Yeah.
But again, there are people using these in athletic settings. And at this point, even that is sort of arguably a waste of time, because again, glucose homeostasis is way more complicated than that. And then also, we want to look at these things in hopes that they drive a change in our behavior or something that's going to drive us to perform better in whatever we're trying to do.
Right.
The glucose in the blood isn't always the best thing, especially since we know that as exercise intensity increases, so studies looking at individuals who are really high level endurance athletes, they spend a lot of time on the top end of that range or out of range, because high stress, inflammation, a lot of that's just sort of part of it. You end up having you almost end up staying in a hyperglycemic state. Maybe not the best analogy, but there are individuals who, think about those that are critically ill. Managing blood glucose in the hospital inpatient is a huge component of care. And so those individuals often have, it's a balancing act of hyper and hypo a lot of times, but in sepsis and in these really seriously critically ill cases, hyperglycemia is rampant, what I mean? So, in general, for those looking to use this for athletic performance, we're still not there yet either, because in general, if you're an endurance athlete, that the energy availability overall that you have on a given day, week, month basis is bigger than anything.
Right.
When you go out to train, when you go out to compete, being in a adequately nourished state across the board is optimal.
Yeah.
Is knowing your blood glucose is going to change that. Is that really going to change the fact that you consume carbohydrates before and during a marathon? No. We already know, based on other evidence and things that have existed since the 20s, that that's probably a good idea. We know that hypoglycemia is a bad place to be.
Yeah.
And so ensuring that you're adequately nourished going into a pretty serious event like that to prevent that from occurring is probably a good idea. So maybe like artificially changing the level that's in your blood glucose by testing the whole time you're exercising is not really going to get you anywhere. And then also it could cause some people to freak out.
Yeah.
Okay. So you are somebody who exercises a lot, in an endurance setting, and then you start seeing all these higher blood glucose readings. Does that automatically mean there's a pathological case existing here? Not necessarily, and again, I'm not saying that's you do 10 minutes on the assault bike, really challenging, that your blood glucose is going to skyrocket. I'm talking about people who, it's a much higher duration.
Right.
But in general, you're going to see some spikes and some fluctuations when you exercise. And that's just part of the game. That's just part of your body. It's part of the adaptive process.
It's not pathological. It's literally how you're designed to work.
Mm-hmm. And then over time, theoretically, those that perform best in endurance settings notice that there's this better control of these blood glucose excursions. So how do you know that? It's whenever you give somebody high carbohydrate meals, or they do 50 grams of glucose before their exercise, and then they measure their blood glucose, and there's not these crazy excursions, even though they've supplemented them with extra glucose, So I just kind of say all this to help the listener realize that you can accomplish a lot of these performance goals at this point in time without continuously monitoring your glucose. Now, lactate meters and those sorts of things can potentially be useful. Or if you're in a lab setting and it's for lab purposes, that's different. But like if you're just doing CrossFit and you think that the next thing that you need is a CGM to improve some metric performance, I think it's buffoonery at this point.
Fair enough.
Buffoonery.
Anything else?
That's a DiMatteo senior phrase if I ever heard one.
Is it?
I think he has said that. I don't know where that came from.
Buffoonery.
That's so funny.
Did he ever accuse you of buffoonery?
I'm sure he would. I'm sure he would. I'm sure he has. We talked about Peter Attia a little bit.
Yeah.
We
generally like Peter Attia.
Yeah, and he's a respected guy in the field.
That sounds so arrogant. We generally like Peter Attia. He's pretty okay.
But I mean, in his book, he has a whole chapter talking about, blood glucose management, and a chunk of that is specifically in reference to the use of CGMs. And his thing was that this could potentially help us start detecting diabetes, pre-diabetes sooner than what we already are.
Right.
I don't think that that's the case right now. I'm not going to be like, this guy's an idiot for proposing that. That's not what I'm saying. I don't think that it's there. I think we can get there as these devices continue to improve, and as we continue to compile large cohorts of people that have used these that are truly, in normal ranges. There's not enough of that information right now that we could get to that point. But it seems like since I've read that chapter, he has almost maybe softened on some of that. And in an actual conversation that I heard him have in preparation for this, he's mentioning CGM as more of just a tool at this point too, and not hey, you might catch pre-diabetes early. Because I think there's harm in that. Yeah. Because then that's what's going to drive somebody to walk into their pharmacy and pay $300 for a system of CGM. That sort of fear mongering. Yeah. I think that's where this can blur a little bit. And I sense that even though he wears one all the time, I believe at this point, I think he has maybe changed the verbiage on how he just discusses this. You know what I mean?
Yeah. And he's a tool. He's a medical doctor, so he has a lot of context. Mm-hmm. And he's talking to people who, in his practice, it's exceedingly affluent people who are really trying to dial in, and they have a whole team of professionals that are all looking at all the data. Yeah. So it's not like an individual person is fixating on a number. And it sounds like he has patients that are almost like, no, I don't believe that these foods do this to blood sugar. I don't believe it. I'm fine, and it's almost like, hey, well, you have the money to do it. Slap one of these on, and then let's look at your information. And so somebody whose dietary pattern is largely comprised of, processed carbohydrates, maybe there are more spikes, and so for that person, it's a very specific person who needs that kind of proof in the pudding sort of approach. But for the vast majority of people, they need understanding. They need good information. They need to not be scared of information. You know what I mean? It's more of a conversation and say, hey, there are metrics, there are tools, there are measurements that we're already doing. Rest assured, we're looking at this stuff, and I don't need to scare you into looking at something 24 hours a day. Again, the other, 400 pages of that book are probably more applicable to the vast majority of people at this point than that 10 pages. Sure. And I would like to go back and, reread it again. And I think, we always say that we can logically come up with all sorts of, logically it makes sense. Let's try and catch diabetes even sooner. Yeah. I mean, it's a huge percentage of the population, and the majority of that percentage are type 2 diabetics, which we think largely can be prevented. So let's try to detect this sooner. The premise makes sense. And now you have this thing that can see every possible blood glucose excursion. So it's tempting to say that this is the panacea for all people. Let's slap one of these on everybody and we'll just know. But again, at this point, it's not that it's accomplishing that much more. There's just no way. The point of having that data would be making lifestyle changes. Yeah. And the lifestyle changes that it would suggest that you make are ones you already know you need to be making. Yeah. And you can already justify those changes based on a whole host of other data that doesn't require an expensive device. Right. Thank you. That's my job. That's what I'm here for. All right. Well, thank you so much for listening through all of that. I'm really excited. I think this is fascinating. I look forward to revisiting this in a couple of years or more, perhaps, when they are all over our watches automatically. If you heard anything that you would like to share with somebody else, please, we encourage you to do that. Share episodes with friends and family. That's the best way you can help us. Also, leave a thumbs up or a like or a comment. We love comments, particularly comments about how Josiah should be training and you want to watch videos about that.
Yeah.
Drop those down below. Any articles we reference, and we actually did reference a lot here, those will be available in the show notes. AskJoeDiMatteo.com is our website. That's www.askjoedimatteo.com. That's our website. You can find this episode, past episodes, the show that started all this, the Ask Joe DiMatteo show. Lots of buffoonery available.
Buffoonery.
Not with Joe DiMatteo. He wasn't a buffoon, but lots of stuff you could check out there. There's also a whole bunch of supplements and other things that don't cost $80, all available there on our website. What else am I forgetting? Thank yous. Big thank you to Josiah Schweinberg, our engineer, half marathoner, Michael Deppish, our editor, Joyce Gibb, our nurse practitioner who handles private consultations, Diane Silverman, who does product, manages the product on our site, Terry, who does scheduling, Cecilia, who does distribution. That's Dante DiMatteo. I'm Tyler Andrews. And that's it for us. Thanks, guys.